Good morning, welcome to Endovascular TV. I am Ángel Tequier from the Bellvitge University Hospital in Barcelona, and it's a real pleasure to have this interview with Dr. Oliver Deller. Dr. Deller is Director of Marketing and Sales for Boston Scientific. Thank you very much for participating in this interview. The topic is how health economics is a very complex and a very actual or current topic. The classic model of relationship between the industry and the clients or professionals of hospitals probably is changing. Do you think that this relationship should change from one scenario where the industry give devices or provide devices or products to another scenario where the companies will give health services?
I think yes. Yeah. So first of all, thank you for inviting me. Let me remove the doctor. I'm honored that you call me doctor, but I'm not a doctor. Not to worry. But yeah, I think there's a lot of tendency these days to look at the full impact of innovation on the healthcare systems, and at Boston Scientific and in the industry, we focus a lot on providing solutions around health economics. And this really first starts when you look at innovation itself. So when you go for a new product or a new technology, not only do we look at the technology, we look at economic outcome as well, together with the clinical outcome, and it plays an important role for us to decide to go for a technology or for an innovation. And we also offer solutions that we feel strong that are addressing more and more the needs of hospital providers and the healthcare system around like efficiencies, driving procedure, not only with technology, but also through education, which is a strong focus for us, and also looking at cost data to justify a certain procedure or to justify new technology use in a procedure. It really absolutely plays an important role for us.
Do you think that this particular strategy is similar to in all the different countries in Europe? It's possible to apply the same strategy to all the countries, because there is important differences in relation to the different health systems, and also difference in the cost of the devices.
I think so, yeah. You can see and look at this like a global question. In all healthcare markets, the situation is the same. We are seeing an increasing number of patients through the aging population and the age pyramid. So it creates more demand for healthcare. Also, we see new technologies enabling to be able to treat more patients. And at the same time, the healthcare budgets across the globe, either best case stay flat, but in a lot of cases they're actually going down. So we have to look at this and respond to it. And one of the contributions I mentioned already that we have done and we continue to do is around education. Like this is a very strong partnership that we have with the clinicians historically. And in these days, when the budgets are limited, this is probably more relevant than ever. Like let's take an example here that's meaningful for the cardiovascular community, and look at complex PCI patients. We treat around about 1.7 million patients every year in Europe with PCI, and about 85 of those have severely stenosed, calcified lesions. And only about half of them get the technologies that probably would help them getting better treated. And we see ourselves playing a key role on educating the clinicians on this, to do our contribution to treat the patients, but also to fill in gaps where probably in the past this education was carried by the provider or the system, and now it's more responsibility of us.
And then you mean that Boston Scientific is prepared to deal these new approaches to the coronary heart disease or valvular heart disease?
No, absolutely, we do. Another aspect of that on treating and educating is around economic models. So we have several studies ongoing across different technologies in Europe to prove that there's an economic benefit, for example, to use a certain technology in those complex cases for PCI. And in a similar way for TAVI, I think if you look at the first generation going back 10, 12 years for TAVI and how the patients were treated and the amount of effort that was done in the hospital to treat the patients, these days this has become a lot more efficient. Like the technology has improved a lot on vascular access, also allowing to treat more patients transfemoral, bringing down complication rates and costs on this. And in today's age, we're actually looking as well at studies to prove that it's safe to discharge patient early, which also helps removing a cost burden from the hospital and has a huge economic impact because hospital bad days are a scarce resource in almost all the markets for the providers. And the savings that you generate with saving a day of a patient staying in a bed goes beyond just the cost of the bed. It actually is a system, it has a system impact, and we have seen many examples across Europe where procedures get cancelled, labs are not utilized due to the fact that over a period of time, e.g. we are heading in the winter season, the hospital beds are not available. And this is how we drive together with technology and looking at the impact of technology on reducing the economic burden to overall tackle the budget impact and the limitations on the budget.
And do you think that this particular new approach to pay per results and not pay per devices, do you understand me? It's an approach that probably in the next years will be a big extension in all the countries?
Yeah, I think so. I think it will be a key criteria to get actually funding for it. And we see this as a tendency, if you take the UK, for example, with the NHS and NICE, when historically a lot of the work on giving reimbursement for pharmaceutical products and medical devices was based on technology assessments only on pharmaceuticals. And this is now coming into medtech. So to answer your question, absolutely, yeah, there will be an impact and this will become more and more reality. And that's going back to what I said earlier for innovation. We actually look at this, and this is an important factor for us to decide if we want to invest in technology that we can help driving the economic burden down.
Okay, thank you very much. I think it has been a very interesting and clarifying explanation and interview. Thank you very much for coming, and thank you very much for your time.
Thank you.